Yeah.
Okay, great. There's a party going on in the background, so you hear some hooting and hollering. Don't be surprised. Happy holidays, everybody. Hope everyone's getting ready for it's going to be a great holiday. I wanted to share a case today, and I won't say the disease yet, but it is tick-borne disease, and it was a more serious case that had come up to us. The diagnosis date was 11/18, so just about a month ago. And so it's a little bit later in the year than you would expect, for the busy summer season. So I shared this here. I messaged out to Ashley, and here we are. So, Ashley, is this screen show in full right now?
Yes, looks good.
Okay, great. So, just stop me if there's anything that doesn't appear. Okay. The clinical presentation is 73-year-old female. She has medical history significant for hypertension. She has hyperlipidemia, COPD. She's completely independent and was at work. She works full time, and she drove home one evening. Her sister, who sees her frequently, almost daily, found her in her bed, just exhausted. So down there's a chief complaint of confusion and extreme lethargy. And so per the rest of the charts, when I did a chart review, did not remember driving home. And when her sister got there, called with concern because the car was not in gear. It was just in the driveway, still running. And her sister didn't remember at all having a car. So, of course, they were concerned, so she went to the hospital. So stop me for any questions. This is not a didactic or some kind of present. I'm not a professor or anything. So just if you have a question, put your hand up or stop me. Timeline, just I made this just so you can see briefly. Basically found at home, like I said, appears ill. She was feverish. Her sister tried to just, did a quick exam and said, okay, how are you feeling? And she said, I feel a little hot. She had immense confusion. Again, that was probably the biggest thing that, again, did not remember at all even having driven home, which is not good. Her family obviously brought her to the hospital or, called for attention. They did immediate vitals checks and they're semi-normal. You'll see in a second. The vitals start dropping and really concern the staff there. Again, you'll see these in a minute. And ID is consulted at the hospital. And then in a little bit, we'll see a workup by the staff through which they did labs, a thorough assessment. They considered all her primary medical history. And then taking into account, of course, her age, she's 73-year-old female. Upon arrival, here you are, vital signs. They took temperatures multiple places because it was fever. So they had 39.4 rectally, pulse is 93, respiration is 18, and the blood pressure being the biggest concern was 143/81 when the medics took it. And then skip down to the bottom there, you'll see your blood pressure was subsequently dropping down to 82/53, and then eventually wavering around the 70 systolic. Anybody here that's clinical will know it's a little bit concerning and not good. Here's the labs. I'll show the same exact screen, but with the remarkable ones chosen. Kind of a discussion point. Which ones would be remarkable to you guys? Which one do you think would be a little bit of concern?
Anybody can pipe in on this one.
The answers will be in the next one. Don't worry. There's no take-home test. Anything stand out?
So you had a white count's low.
Yep. So over here, okay, Ashley, can you see my mouse?
Yes.
Okay. So Dr. Collins is saying the white count. Yep.
And what is the creatinine? I'm having trouble seeing it. I'm sorry.
The creatinine, sir, is 84.
8.4, maybe? Must be different values over there.
Yeah.
Right?
Her bilirubin is 1.54.
Platelet count's a little low.
Platelet count here. Yep. Dr. Collins says platelet count.
Sodium's a little low.
I would definitely this stood out here, but then to me this stands out.
Yeah.
So just the next one I kind of just put just in red. Yep, those four things. Dr. Collins, do you think this ALT is a little tad bit above?
Yes. Exactly. 124. Yeah, I keep 40. In my own head, I keep under 40 for both. Different labs have different values, but I definitely think the ALT is elevated there.
Yep. Okay.
Vanessa, do you have a question?
Yeah, is that the creatinine or was that is the BUN?
Oh, I'll double check that when I entered. I can actually double check that too in a second on my notes, but I'll check this up. I'll check
Okay.
afterwards to see. But but she, this was the four things that pointed out by the consult as well. Here, they had mentioned this, but they had really pointed out they're really concerned about really this, and then of course the blood cell. All right, good deal. So so you guys have an idea, context of who this is. This is kind of what was listed on the on the list of significant primary medical history, or past medical history rather. So I try to put little cool diagrams here to make it a little better than text. And then down the bottom, the question there is most worrisome when considering tick-borne disease, or something that stands out and worry.
Well, what I would just say myself is that in addition to tick-borne illnesses, I'd be going down two paths: the tick-borne and the non-tick-borne. I would say infection on the top, but I would sort of step and say this could be overwhelming sepsis from anything. And with altered mental status, I would want to do an LP if I can do it safely. If she doesn't have a focal neurologic exam, I wouldn't even request a head CT. I'd do the LP because I would want to work it up that direction too.
Sure.
Although I don't know what her exposure history would be either. But I think to me, we got to think about septic shock from any etiology, not just tick stuff. And I know we're doing a tick thing here, but this is certainly something that I would be worried, maybe the white count in the pleasure with sepsis.
Okay. Yep. So top concerns. Yep. Just so in general, top concerns is that, of course, dropping BP and the suggestion of sepsis. Of course, they had given her pressors. She did remove a tick the week prior, just because, of course, this is a tick-borne. Like Dr. Collins said, we should consider all things with somebody septic as to what the etiology would be, whatnot. But in this case, she had removed a tick prior, and so while she was there, she did get 3 liters of fluids. So she went through quite a bit. She denied all of these, and I figured I'd put these out so folks could see. So she denies headache. She denies nausea, vomiting, abdominal pain, anything like that. That's not normal for her. She did have occasional mild neck pain. That was prior to this, and just that's what she lives with. She said she had mentioned in her notes. Any questions about this? So this is just so from here. Any kind of thoughts? It is a tick-borne etiology. I didn't have a ton more on it before getting to the ID consult. Any thoughts as to what could possibly be given that presentation? Her fever being significant, and as well as her getting into being septic and having a pretty bad infection, lethargic, confusion.
The low white blood, I'm jumping in here, the low white blood count, anaplasmosis?
Sure. And with asplenia, that would make some sense too, that she's this sick. With no spleen, I'd be, I'm not surprised she's in shock. That would be the top of my list, would be that one, as far as tick stuff. And I couldn't remember, was her red blood cell count normal or not?
Red was fine.
Okay. I would certainly be looking for co-infections too. I would want to look for Babesia, because that's also really makes people with no spleen sick too. And then I would want to jump on that as well. At least look for it to get an LDH and a haptoglobin or something. But yeah, I'd say anaplasma would be at the top of my list in this case for tick stuff.
Great. Okay. Great. So here we go. Determination follow-up. And so, yep, hit nail on the head. Doctors chose to diagnose this as anaplasmosis with septic shock, secondary to anaplasmosis. The ID came, and they can after they had kind of stated her, made her a little bit more stable, and they started to consider sepsis quickly, but then they needed to rule out several causes. Indeed, so it did take a little bit, but they did find out from her when she kind of became more too, and her family came to get more history about the tick, and that's when they started kind of ruling in ticks things. She had treatment. There was probably more treatment than this. I'm just going off of chart review that she was given. I know of 1 gram of Tylenol, and then also she got vancomycin as well as this. And after the results were available, she was given doxycycline 100 milligrams IV. So they did get her on doxycycline pretty quickly through IV. And over time, it was noted that she had quick improvement. Her renal function improved markedly. They had, per the note, and her fever came down. So
did they test for other co-infections? Do you know?
according to this, I don't have a, let me see here. Good question. They did a panel. Let's see here. No, this is the only positive that we had. Let me see here.
So you did a panel too, okay. But for instance, I mean, it would be, I would at least have, and doxycycline will get Lyme if she had it. That's no question about that. But
Yep, no, doc, they did. Yep, they did. Check Babesia serology, stat, and PCR. Trend inflammatory markers, and check for Lyme, check anaplasmosis, PCR.
Good.
Yep. So they considered those.
I guess the only thing I'm surprised about is before they knew it was a tick thing, why she didn't get a spinal tap. We seem to be moving away from those, at least at our hospital, when they should be done. And I think I presented a case earlier where there was a pregnant lady that walked around with meningitis for a week from Lyme or more because nobody bothered to do the spinal tap. Now this case, I bet you if you'd done a spinal tap in her, it would have been abnormal. You can also get an encephalitis from Babesia, from anaplasma. But regardless, at this point, obviously she got better with what everybody did, but I just don't, I'm beginning to see this trend disturbingly in a lot of places where spinal taps don't get done. So it's always nice to be hindsight's great, but I think she still had enough platelets to do it too. Her platelets were 134,000. You can do a spinal tap safely with that.
Wow, interesting. Interesting. I'll look for that, Doc. That's interesting. And you don't see that so is that pretty much standard of care, or is that something that you would just do as additional?
Well, I think with fever and altered mental status up to the point where somebody's leaving their car running, don't remember driving, they need to have a needle put in their back. That's my opinion. And probably would have gotten a CAT scan on her too. I don't know if they did that. What I see happening is they get their head CT and then nobody ever does a spinal tap. I wonder if they even got a head CT on her when she came in the ER.
Let me check.
Thank you.
Yep.
I know I'm getting off the tick-borne thing, but this is one of my pet peeves, is that we don't do a workup. I think a lot of it is like, for instance, people that don't do LPs don't want to think about, I think there's a bit of denial because if they can't do them themselves, they don't want to go there.
Wow. Well,
Is it unusual to have anaplasmosis present with septic shock?
It's not totally, I'd say it's unusual, but it's not rare.
It's not rare.
And especially if with no spleen, it would not at all be unusual for someone with a spleen to present with septic shock. Those are the people that really get sick, just like they do with Babesia.
Okay. So, like the ones you had a few fatalities for anaplasmosis, or one here this last year, is that how they typically succumb?
Yeah,
to septic
and
shock?
the fatality we had here, ID was not even consulted, and by the time they figured it out, they put him on comfort care, and it was over. Which that case still bothers me. But yeah.
But that is how.
Yeah,
why
exactly.
it becomes fails.
Exactly. And by the way, what does she do for a living, and what's her outdoor activity? Do we know? I'm asking you a whole bunch of questions. I'm sorry.
No. Of course. So she works at a. Let me see here. She works at like a deli. She doubles at 2 different stores, helping in the deli.
Okay. And she must get outdoors a little bit or something, I would say.
Yeah, she is.
Do you know where she lives?
In southern Essex. I don't want to give the town just because of
Sure.
the county case, but in southern Essex County. So most of our southern Essex counties will go down to Albany or Glens Falls, hospitals. So this person didn't go to CDPH or UVM.
She went to Glens Falls or something, or whatever. Yeah.
Yep.
All right.
Down there. And she, let me see here, Doc, I'm looking for the CT. I don't see a CT ordered. Of course, it could have happened. I don't have the whole thing.
Right.
But she actually, with this value, it is 1.54. Sorry about that.
That's okay.
Yep.
Well, just for the sake of argument, for instance, just to throw it out, people that have fever, altered mental status, don't remember shutting their car off, one of the things to think about in addition to bacterial meningitis would be herpes encephalitis. You know, and there's no way to rule that out if you don't do things. And luckily, this was a tick-borne illness, but I personally have been going down the tick pathway and realized I was treating endocarditis with doxycycline. And I do think it's worth us considering that. I know what we're reading for, but part of this is to remember that the differential is still broad, and especially when somebody comes in like this. I would have definitely wanted to throw doxycycline in the mix, but I would have definitely been looking for everything else, not just ticks. But I'm also paranoid.
Absolutely great. Thanks, Doc. It's incredible. And I'm looking through here and trying to see if they had done. I know they had done chest X-ray, and that was because of their concern with such a long smoking history. So here, 40 pack years. So, boy, that's not short. So,
Right.
Yep. So that's not good. It's 40 pack years. This reports, and let me see here. So they had done chest X-ray to be, worried about infection through that way. That was the rest of their workup, according to this.
Do we know if she had pets at home?
According to this, let me see here. No, good question. Nope, it doesn't say. She lives with family, independent with all ADLs. Does not use any assistive devices. Nope, it doesn't say.
So the reason I'm bringing that up is because also if you have things like cats or dogs and you have no spleen, you can get life-threatening Pasteurella or Capnocytophaga infection that can look identical, can have low white count, low platelet count, everything. And so again, I'm making this differential broader because I just am.
But no, it makes sense. I mean, cats and kittens specifically, the toxoplasma, right, can be very concerning.
Well, what you worry about mostly with cats is Pasteurella, and with dogs, it's Capnocytophaga, although dogs can have Pasteurella too. But the typical patient that really gets sick from those is ones with the person who doesn't have a spleen. They can die just like they can from anaplasma. And again, you'll get a low white count, sometimes some overwhelming sepsis and a low platelet count. So there's a lot of overlap along tick-borne illnesses, unfortunately, with a lot of other things. And so maybe I'm glad you presented this case because it lets me at least get on my soapbox about talking about other stuff this could be.
Of course.
That's what we have to do when they come in our door is we don't know ahead of time, obviously, and you know that, I know that.
So it seems like the meter keeps flipping.
Yeah.
We weren't considering tick-borne disease at all, and now we might consider it in lieu of something.
Too soon sometimes. Well, I just don't, I guess what I'm trying to say is don't go down exclusively that path. I would certainly want to treat for that while I'm trying to figure it out, but I would not bet the farm on this being a tick until we had more information.
Certainly. This they were concerned, according to this workup here, with any kind of infection, because they had, of course, and that I think that because I couldn't, of course, put her entire past medical history on here for you guys, but just a summary that this was not doing well, that she definitely is on a few bronchodilators, so forth to help her with her COPD.
Right.
So this person presenting at 73 years old, this was the initial workup, and then they went, it sounds, and considered, like, do you have any kind of outdoor exposure, like Dr. Collins was talking about. Her sister came to help her and give information. It says on this notes, her sister gave full info and history. So this came out. This was part of her chart. And the question I had from when I was doing this is, what would be a valid reason for getting rid of this? I mean, maybe, of course, besides the obvious ones, I mean, cancer or something like that. It says here, I looked up this past surgical history, splenectomy -20 plus years ago. So it's not recent.
Yeah.
So
that's it's a good question. It would be nice to know why they took her spleen out, whether it was trauma or whether it was, sometimes they'll do that for ITP if they can't control it. Idiopathic thrombocytopenic purpura, immune thrombocytopenia. Sometimes they'll do it for that if they can't get it controlled any other way. But it would be nice to know.
Yeah.
And it would be nice to know if they got the vaccine she was supposed to get before they took her spleen out. Which would say, I know you can't possibly know that from this case, but if you know you're going to take somebody's spleen out, there's a whole list of vaccines you're supposed to get before you do it. So just to throw that out too.
So Justin, is this case like number 44, 45 of anaplasmosis in Essex County this year, at least?
Absolutely. We've had just over 50.
Oh, really?
That includes all case statuses for the county. So
Okay.
I can't, confirmed it's mid 40s.
Right.
And then
Which is probably an underestimate because of all the seasonal visitors and residents that aren't reported through you guys. Right?
1,000%. So many people who still list their main residents don't legally have to up here in these
Right.
vacation towns. You talk about places like Minerva, and you talk about places in our county like Minerva, on the edge of Ticonderoga, which would be Putnam. On that edge,
Right.
yeah, Ticonderoga, closer to Hague. Those people, 3 months, 4 months, they're May to August or May through September here, and then they head out, and their address isn't here.
Right.
So,
Right.
yeah,
This
It's
was
probably-
in November.
In
too.
November, but so the fall tick season started Columbus Day weekend. That's when the adults are out. So for some reason, it's not associated with as much human illness as the summer months when the nymphs are out. Whether that's just because people don't see the nymphs or because the nymphs are better transmitters of disease.
Or
It's got to be
there's-
partially
there
that.
are less people out.
There's
during
less
that
people
time?
out.
But in the fall, the hiking season, I don't know.
Yeah.
It just seems like, but the ticks are out. They do carry disease twice as frequent in the adults as in the nymphs.
I can see them waking up. Columbus Day, let's go.
Right. I mean, we were out this summer in Essex County. Jake and I were there. We collected at one site, oh my gosh, 100 ticks in 10 minutes?
Wow.
Yes.
Oh, so you're the tick whisperer.
He's a tick whisperer.
Yeah.
So it was a real explosion this fall.
Yeah, it was crazy.
Wow, yeah, totally. And over definitely any of the marshes here in the county, New Russia, right? You guys had done.
Yeah.
Wow.
Yeah, we were even at Otis Mountain this year at Sue's place, and this was at the Elizabethtown SPCA. That's a huge spot, and we're getting a lot of triply infected ticks there. So this fall season was really gangbusters.
I just know for the past few years, we've been seeing more and more anaplasma here too. I mean, it's
Yeah.
just, there's probably cases of anaplasma, just like there is for Lyme, that don't ever come to medical attention.
sure.
People do shake it off.
Yeah.
They're younger and
Right.
healthier.
So I sent, you're probably aware of it, Justin. I sent a copy to you, Keith. I don't know if you saw it, a paper that's written up about the anaplasmosis human cases over the last
Oh, good.
9-10
I
years.
haven't seen it yet.
I've sent it to you, but you probably were busy and got buried.
Yeah.
I
Oh,
could
my
resend it, but it does talk about the cluster kind of that's happening in Essex County. And they've done some work on the genotyping that showed it's a highly virulent strain. So
Wow.
I'm going to follow it really carefully if you guys don't have time. And keep you up to speed on that. And
Yes.
but it seems like something really interesting is happening in Essex County with anaplasmosis that the state epidemiologist is interested in. But the focus seems to be on, it's kind of like a little satellite spot in Albany area is the main place where this anaplasmosis is radiating. But it
And
seems
then there's a hot spot right
it's a
there.
hot spot, but in Essex County is getting kind of lost in that hot spot. But if you focused on Essex County, I think you would see that it's a hot spot on its own right.
Yeah.
So
Sounds like it.
it does. So I'm going to look into that a little bit more and push them on that.
A worthwhile thing, Leanne, would be to check in with like Peggy or somebody over at Clinton and just have them run a count of the Clinton cases.
Yeah.
Because which I can't do because of HIPAA and whatnot. But they can run quickly the count for their cases.
Yeah.
Total or then confirmed. My confirmed are low 40s, but that's like I've also dismissed for this, that, and every other technical thing, which I have to, probably about 10 or 15 over this year, which that would include no response from provider. All your providers, we all love you, all providers. I'm just saying, not you guys, the other providers, but no response from providers.
Yeah.
No response from
It is
providers.
weird that no one is focusing on the North Country as a collective unit. Like Justin's focused on Essex.
Yeah.
Like he says, he can't even call it Clinton. And so it's kind of fun to
Right.
step back and try to get this data, and stuff's happening up here that nobody's paying much attention to.
And I assume that they diagnosed this by PCR. Is that what they did?
Yes, yep. It came through as a PCR. That was on 11. That was on 11/12. So they did it pretty quickly. And then we made the case 6 days later for 11/18. So she's an 11/18 case, right before Thanksgiving, which is crazy because remember how cold it was. I don't know if you guys, I was outside around then working, getting stuff ready for Thanksgiving and whatnot. And remember it was cold. Like people were not outside then. I mean, that little early kind of freeze here, at least here. And it just doesn't make a ton of sense that this woman would be really outside a ton. Nothing in her chart really had mentioned, animals or, things like that. Like Dr. Collins had mentioned, she does work every day. So I don't know if for work there's anything to do, but that's a deli, a store of some kind.
Yeah.
So
it would be neat to talk to her to find out what her exposure risk might have been. But obviously we can't do that, but it'd be neat to know that.
Totally. We had attempted kind of follow up as a health department. We usually will, as soon as basically as health department providers give the lab result, we try and stay away from that unless it's like vital, connect them with care or whatnot. And then afterwards we'll follow up for that. And when we attempted to do, didn't get a phone call back. So, but we can see the rest of the case and work with ID staff and infection control staff at the hospitals, regardless of which one, and find out some of these details, at least to know clinical side. And this is what's there for clinical, what we know. And one real quick correction. Somebody mentioned out the creatinine, and I definitely did put that in wrong because creatinine 84 sounds to me like really, really off. Creatinine is 1.81. So sorry about that. That'd be the highest creatinine in like the world.
All right.
They even report that high.
I'm sorry.
Yeah. But let me see here. Also one thing I didn't put in was I should have included was her. They had broke down and looked at the neutrophils. So just neutrophil conclusions consistent. They had just put these were not very cohesive notes. They were just neutrophilic inclusions. They put actually because after a PS was neutrophilic inclusions, consistent with anaplasmosis present, or says here reported presence of neutrophilic inclusions. So.
Wow, so they saw it then. Morula sounds like they actually did.
People love it when you see it.
I do. I just think it's great. Vanessa had a case she showed this year that she had one. She picked it up herself, which I still am not over. Yeah.
That's right. That day that you showed all the blood smears and you looked at, right, Dr. DeMera?
Yes, but in my defense, I used to work in the lab, so.
Me too. That makes two of us. There you go.
Yeah. Well. Does anybody else have any other questions or thoughts on this woman? I have the history here. It's not super in depth, but
I think that was great. Thank you. That was really good.
Okay, great.
It was a lot to think about and talk about.
Yep. We haven't had somebody come through with this much confusion, as such a chief complaint. And given her age, they were considering kind of more, if dementia and things like that, at first, the very first doctors on their list, trying to figure out, what in the world you could lead her to be that, confused. And so that this kind of stood out. I do see other cases where I see that mentioned, but not to this level. Not on any of the other chart reviews we do for the CDS supplements. Do we see stuff like that bad? So that's why I figured to mention it. Somebody that ill or that confused and things.
That's good.
Mm-hmm.
Yep.
Well, terrific. Thanks, Justin. This was really, really good. And I so trusted your judgment and confidentiality that I actually recorded this session. Just knowing that you wouldn't have a PHI breach. So we'll be able to post this on our website, Jill. That way we can get anyone who wasn't able to join today. I know we're a little late on attendance, but I think everyone else is probably partying for the holidays too. So we'll have this up and recorded for other people to take a look at. Justin, you did an awesome job presenting.
Thank you.
And I think we'll give you back some time to eat for all of us. So you've got a big undertaking. You have to eat enough party food for all of us.
I've got a great worm case. I know it's not tick stuff, but at some point I just got to show you guys the photos.
A what
Did you say
case?
worm?
Worm.
That'd be good for right before you eat lunch.
Yeah,
Exactly.
really. We'll spare you on that
Only
one.
60 cases reported in the world, and we have one.
Really?
Really?
Oh,
Ganglionema pulchrum.
Is there a comment?
Wow.
Nope.
Was it somebody traveler?
Nope. Nope. I'll have to throw it in next time just for fun,
Good.
and we'll put some pictures up of it. Even though and I'll do the post-treatment Lyme disease syndrome, and I'll present this case just because it's fun.
Yeah.
How's that?
We're at the end of our grant. We can do what we want.
Right, exactly.
All right. Thanks, everybody. Enjoy the holidays. We'll regroup after January, so you'll hear from me when we've got January dates settled. And then that's it. Everyone kind of gets to graduate out after January. So thanks for being with us this year.
Yes. And come back one more time, because I think the second most important one is the one we're going to do last, which is the post-treatment Lyme disease syndrome. I think it really is an important one to get. And I just couldn't do it justice today, so we'll do it in January.
All right. Thanks, everyone.
Thanks.
Bye.
Bye.